Caribou, welcome. We want to introduce you to the Tangibility Study, and more importantly, to explain why this work matters, not only academically, but for future patients, communities, and the healthcare system as a whole. I'm Professor Kristen Mark. I'm from University of Minnesota in the USA, and I'm the co-lead of Tangibilities. I'm joined here with my colleagues from Muhimbili University of Health and Allied Sciences in Tanzania, Dr. Dixon Makoka, my co-lead, and Dr. Stella Moshi, our project coordinator.
This began with a simple but powerful idea. Healthcare is only truly effective when it reaches everyone. Yet in Tanzania, as in many parts of the world, there are a population who remain largely invisible within healthcare systems. One of those groups is people with disabilities. We know that Tanzania faces significant challenges in sexual and reproductive health, and at the same time, people with disabilities often experience even greater barriers to accessing care. These barriers are not only physical, they include lack of provider training, stigma and misconceptions, communication challenges, and healthcare systems that are not designed with disability inclusion in mind.
In fact, most healthcare providers receive little to no formal training on how to address the reproductive health needs of people with disabilities. So what happens? Patients are underserved, needs go unmet, and health disparities grow wider. This is where Tangibilities comes in.
The Tangibility Study is a collaborative effort between MOHAS and the University of Minnesota, and is supported by the largest health funding institute in the US, the National Institute of Health. Together, we are working to address a very critical gap. How do we train healthcare providers to deliver inclusive, competent, and respectful sexual and reproductive health care for people with disabilities?
The study has three main goals. First, we aim to understand the real needs, both of the disability community and of healthcare learners. We collected qualitative interviews and focus group data to inform us in this work. Second, based on these interviews and focus groups, we developed a locally relevant, culturally grounded curriculum built here with Tanzanian expertise and lived experience at its center. Third, we are rigorously testing whether this training actually works, whether it improves knowledge, skills, and ultimately patient care. This is not just education, it is science. It is a randomized controlled trial, which is the gold standard in health research, designed to produce evidence that can shape future training, policy, and practice.
And I want to emphasize something that's very important to us. This study is not just about helping a vulnerable group in some distant or abstract way. It is about transforming healthcare practice, because we know that healthcare providers encounter patients with disabilities in every setting. They can encounter them in clinics, hospitals, community health programs. And the question is not whether they will serve these patients. The question is, will they feel prepared, confident, and capable of providing them with the care that they deserve? One of the most powerful aspects of this study is that it's guided by a community advisory board made up of Tanzanian disability advocates and community members. This means the curriculum was not designed for people with disabilities. It was designed with them. Their voices, their experiences, and their expertise shape everything we do on Tangibilities. And that matters because good healthcare starts with listening.
What future healthcare providers, educators, and leaders in Tanzania healthcare will learn during Tangibilities has the potential to ripple outward to colleagues, institutions, and patients. Beyond the research outcomes, there is something even more important. This study invites students to reflect on their own practice, to ask, how do I communicate with patients who have different needs? How do I challenge stigma, both in society and within myself? How do I ensure dignity, respect, and autonomy in every interaction? Because ultimately, clinical competence is not just about knowledge. It is about empathy, awareness, and ability to provide care that is inclusive and equitable.
People with disabilities have the same rights to sexual and reproductive health as anyone else. Not in theory, not in policy documents, but in real clinical encounters with providers who have been trained to provide inclusive and equitable care. And through Tangibilities, we are working toward a future where that right is fully realized.
Asante sana. Thank you very much.